In your surrogacy journey as a surrogate or an intended parent, you're likely to spend more time interacting with the nurse coordinator at your fertility clinic than you will with your reproductive endocrinologist. Now, this is not a bad thing, but it's caused many people to ask me the question, what is a nurse's role in the whole informed consent process? So let's talk about it. Hello, I'm Corlandos Scott, an assisted reproduction attorney in Los Angeles who has dedicated his practice to helping people grow their families through assisted reproductive technologies. And in that work, I often interface with my clients' fertility clinics in order to facilitate the assisted reproduction process. I also love being a speaker. I'm a speaker and I speak at industry events. And one of my favorite industry events to speak at is the annual REI Nursing Conference. And it's basically a gathering of hundreds of fertility nurses from around the country. And last year, part of my talk focused on the importance of informed consent. So I got tons of questions from the nurses about what was their role in informed consent. And I realized that this might be helpful to know as an intended parent and even as a surrogate. So in today's episode, we're going to talk about the types of informed consent, how they are obtained, and I'll discuss the parameters that nurses must remember about informed consent, and you won't want to miss number 3, so let's do it. So what is consent? Consent occurs when one person voluntarily agrees to the proposal or the desires of another person. And the concept of consent exists in everything from law and medicine all the way to sexual relationships. But we're going to focus our attention on where consent and medicine intersect. So we're talking about medical consent. Now, ethically, consent is about patient autonomy, meaning the patient understands and freely agrees to the treatment. No one's coercing them or tricking them. But not all medical consent is created equal. There's levels to this thing, people. So what are the levels or types of informed consent? Well, here's 3 main types: implied consent, verbal consent, and written consent. Now, implied consent is given simply by cooperating with and following the instructions of the healthcare provider. So for example, when you extend your arm and you allow the medical staff to draw blood, the act of extending your arm implies that you consent with what's about to happen. Then there's also verbal or express consent. Now, this is when you verbally convey your understanding and agreement to the instructions of the healthcare provider. Now, verbal consent is typically obtained when undergoing a procedure that doesn't really carry any significant risks. So that's when you can just really verbally say, yeah, I agree. But lastly, there's written consent. Now, written consent is another form of express consent that's given by signing a document. Now, you have to sign the document, but that's signing after you've read and comprehended the document. Now, this type of consent is the level of consent required prior to undergoing complex treatments or procedures that carry high risk. I don't know, like surrogacy. Now, there are a number of components of informed consent, and they all begin with patients' knowledgeable consent to a treatment or procedure after they have been given and understand complete, unbiased information about a few things. They have to completely understand information about the proposed treatment or the procedure. They've got to understand who will perform the treatment or the procedure. They need to know the purpose of the proposed treatment or procedure. They need to know the expected outcomes of the proposed treatment or the procedure. And they need to know the benefits of the proposed treatment or procedure. And when I think about it, it doesn't stop there. You also have to talk to them, and they must understand and comprehend the possible risks associated with the proposed treatment or the procedure. In addition to that, they need to understand the alternatives to the particular treatment or procedure, and they need to know the benefits and the risks associated with those alternatives to the proposed treatment or procedure. And they also have to understand the fact that the patient themselves, they have the right to refuse any proposed treatment or procedure. These are all of the things that you're going to get when you actually get true informed written consent. And in order for true informed written consent to be present, all of those components must exist. So Who has the authority to acquire informed consent? Well, a general principle of informed consent is that it is the healthcare provider who's doing the treatment or the procedure that needs to obtain the informed consent of the patient. And that can include a nurse. So a nurse plays a key role in obtaining consent. Now, in fact, the physician, the nurse, and the patient all have roles and responsibilities in this game we call informed consent. One of the main duties of the nurse is to provide written materials in the client's spoken language. The nurse is also responsible for verifying and witnessing that the patient or the legal representative of the patient, if it's a minor or something like that, to make sure that they've signed the consent document in the nurse's presence and that the patient or their legal representative is of legal age and that they're competent to provide consent. Another thing that the nurse does is confirm that the patient has sufficient knowledge to make a knowledgeable decision based on what they've been discussing. Now, if the patient seems confused about the procedure or has a lot of additional questions, well, the nurse's role is one of an advocate for the patient. So the nurse should instruct the patient not to sign the form until the requested information is obtained and that the patient understands the information that they requested. And then the nurse should notify the appropriate healthcare provider, whether that's the physician or the surgeon or even another nurse practitioner. And all along the way, that nurse's responsibility is to document what is happening as they proceed through the consent process. Now, before we talk about some parameters that nurses must observe, let's talk about some parameters that YouTube observes. YouTube wants to share this video with more people, maybe even, some nurses. But the way YouTube works is YouTube is waiting for you, just you, to smash the heck out of that like button so it knows that it's doing the right thing, sharing it with the nurses. So go ahead. Go ahead and smash the like button and let YouTube know. I'll wait on you. Just go ahead. Great. Okay, finally, we can talk about consent parameters nurses should observe. Nurses should think about consent not just as a piece of paper, but as an entire process in order to really assure that the patient has understanding and agreement. Again, it's more than just signing a form. Now, informed consent should be a collaborative, I would call it an activity really, between the physician, the nurse, and the patient. In fact, the physician should, if they're good, have obtained verbal consent before the nurse even comes in and approaches the patient in order to have the patient sign a consent form. And I love nurses because nurses can offer what they do best, which is patient teaching. They can check the patient's understanding of what's going on, and they can obtain that written consent after they know that the patient really fully understands what they're getting into. And the best nurses use this method that a nurse told me about. It's called the teach back method. And this is basically where they ask the patient to repeat back whatever he or she understands. And that's how you know that you're working with a nurse who really knows his or her stuff and is really communicating at a high level and getting true informed consent. But just know a nurse's teaching and care shouldn't take the place of the opportunity for the patient and the physician to discuss the issue and come to a decision-making conclusion. Now, one of the boundaries that nurses have to look out for is paternalism. And that's when people in positions of authority, they really restrict the freedom and the responsibility of the people beneath them or under them, but they do it in what they feel is the subordinate's best interest. And sometimes that's difficult when, you really are well-versed in your job. So it's not a nurse's job to tell a patient what they should do, even if technically the nurse really knows the most prudent thing to do. They can't be paternalistic in their treatment and education of patients. And nurses really understand so much more than the patient, and they're always trying to help, but they just simply can't pressure or tell a patient what to do. Simply put, nurses can't substitute their judgment and their wishes for the wishes of the patient. Now, here are 3 big ticket things for nurses to keep in mind. Number 1, they must disclose the pertinent information. Remember, the proposed treatment, the procedure, who's going to perform the treatment or procedure, the purpose of the proposed treatment or procedure, the expected outcomes of the proposed treatment or procedure, all that good stuff. They have to disclose it. Secondly, the nurse must assess the competency of the patient. Informed consent really can only be obtained from an adult patient who is mentally competent to do so, except under some circumstances and situations that's really beyond this video. But when consent cannot be obtained for any reason, including the patient is a minor, then the patient is mentally incompetent to make that decision. Or the patient could be unconscious. Then other people in that scenario might be allowed to provide legal consent for the patient, like a parent or a legal guardian or someone who has power of attorney. But informed consent can only be obtained from a competent person. Now, thirdly, nurses must remember that consent has to be voluntary. The patient or their legal representative, they must give consent voluntarily and without any coercion by others. And they also must be able to ask questions, clarify things, get clear on what's going on until they're certain about the procedure, the benefits, the risks, and all of the possible alternatives. Now, factoring into the voluntary nature of consent is the environment in which consent is obtained. Consenting to treatment can be scary, so as much as possible, nurses should obtain consent in a quiet and calm setting while giving themselves time to answer the patient's questions. At the heart of consent is the fundamental legal principle of autonomy and the fact that you have the right to say what happens to your body. So nurses work to protect that right while at the same time aiding the physicians in helping you get access to the best information to allow you to exercise your autonomy where it concerns your medical treatment. So if you need help sorting through the assisted reproduction process, even if it's a question about your fertility clinic or its staff, do not hesitate to reach out to me. I'd love to chat with you. You can click the link in the description box below and you'll be taken to chatwithcorlandos.com. And from there, you can start a chat with me. Hey, I look forward to chatting with you.